Are you overwhelmed caring for an aging loved one? Whether you're an adult child, spouse, partner, friend, or a professional caregiver, then this podcast is for you. Welcome to your Silver Lining. Each week, we bring you valuable content to help you provide the best care and support possible, along with tips on how to care for yourself. Your Silver Lining hosts will cover topics such as recognizing when a loved one needs help, advocating for them in the emergency room, managing medications, maintaining fluid and nutritional balance, handling acute and chronic diseases, and much more. And now for the disclaimer. Keep in mind the information you are about to hear should not be misconstrued as medical or legal advice. See the full disclaimer below. And now on to the show with your hosts, Stephanie and Paige.
Hello and welcome. My name is Stephanie Cameron and I'm your nurse care manager. I'm also the owner and founder of Transitions Care Management, a concierge care management practice here in the Seattle, Washington area. And I'm sitting with Paige, my awesome co-host, who is also the operations manager for Transitions Care Management. We're so excited to have you today. We're going to be talking about a very important topic.
Good one.
Which is how to advocate for your loved one when you go to a doctor's appointment. What do you do before, during, and after? So let's dive right in.
Let's do it. So really, I want to start with asking you some questions about how to prepare for a doctor's appointment.
Okay.
So what steps can a caregiver take before going to a doctor's visit to ensure it's efficient and comprehensive?
Yeah, so preparation is key. As always, it's going to be kind of a common theme that you hear, I think, throughout the podcast. Caregivers can complete a full list of recent and ongoing symptoms, concerns, changes and improvements, include any medication changes. That's crucial. Tracking key health markers like blood pressure, heart rate, blood sugar if they're diabetic, that type of thing. And then sending this information to the doctor ahead of time via fax or through a patient portal can provide the physician with a really nice, clear picture of the patient's current health status, what's been going on with them, and gives them just great information to start the appointment out with.
Oh, yeah. Good. How can caregivers effectively monitor health matrix between appointments?
Yeah, great question. So maintaining a health logbook is really beneficial no matter what shape or form you do it in. It's a matter of consistency. For instance, tracking blood sugar levels for somebody who's diabetic, blood pressure and weight for somebody who has congestive heart failure, and noting any other relevant information that can help in managing chronic conditions. So this consistent monitoring really allows for timely interventions and informed discussions with the provider during appointments. Another thing you can do is ask your doctor at that appointment. You want to come prepared for the appointment you're going into, but before you leave that appointment, ask your doctor if there's any information that you could be tracking, gathering, doing to be better prepared for the next appointment, and ask what else you can do as a care provider to provide more consistent care and a better healthcare picture for your loved one.
Oh, yeah, that's great. So let's talk a little bit about understanding the physician's workload and the appointment dynamics. I wonder what the average number of patients a primary care physician has in the United States. Do you know?
Yeah, I do. As a matter of fact, I looked this up. And this is important information. And here's why. This is why we talk about these appointments being as efficient as they can be, because doctors have a very big caseload. Typically, your appointment times are shorter. We're going to talk about that. But the more you can be prepared going into the doctor's appointment, the more they're going to appreciate, the easier it's going to make their job and the better outcomes you're going to have. So in answer to your question, a doctor sees on average 20 to 25 patients a day. Now, let's take that a step further. If in the period of a year, or you look at their whole patient load, and I looked this number up and I had to look at a couple different sources to make sure it was right, an average primary care physician may have up to 2,000 to 2,500 patients in their caseload all total. So
it's a lot.
It's a lot of information to remember. They're going to look at that chart before you come in, so they know you and they know what's going on. But the more information you can provide to help make their jobs easier, the better.
And how much time do doctors have to spend typically with the patient?
Yeah, on average, it's about 17 and a half minutes. And, there are exceptions. So there are doctors that have fewer patients than that 2,000 to 2,500. There are doctors that are able to do longer appointments than the 17 and a half minutes, but these are national averages. And so you do stand a good chance of a doctor not having a lot of time to see you. And so the more efficient you can make the appointment for them, the better it's going to be for you.
So this goes nicely to my next question of how can caregivers maximize the very limited time they have in that appointment?
Yeah, preparation. So gathering that information before you go in so the doctor can easily access it. They do have those time constraints. So the more you can gather, the better. And then when do you provide that information? So we will often, we're very efficient and we really cover our bases a lot. And so I will always create this report for a doctor before we see somebody. I send a copy off to the doctor a couple of days in advance, whether it be by fax or through a patient portal, and say, please review before this appointment on Tuesday at 2 p.m. And then I will walk in the door with 3 copies. I will give 1 copy to the receptionist and say, can you please make sure the doctor sees this before the visit? And then when I go in the room and the nurse checks in, I'll hand a copy to the nurse saying, hey, just so you know, here's what we want to talk about. And I'll have a copy in my hand. I can't tell you how often the doctor comes in and says, hi, how are you? And I will say, did you receive the information that I sent you about today's visit? And he or she will say, oh, no, I haven't seen that yet. And that's when I can say, oh, that's okay. Here you go. I have a copy. And so it's just, these offices are busy. The staff is busy. It can get pretty crazy. And so there's no blame on anybody if they're not getting the documents. It's just the way things are sometimes. So always have one on hand as well.
That's next level of preparation.
That's next level preparation.
Yeah. Seriously, that's good though.
It is good.
So on, the topic of effective communication and advocacy, what role does efficient communication play during a medical appointment?
Yeah.
How does that play out?
Yeah, great question. And so clear communication is going to help the doctor do a better job for you. So that can happen in a couple of ways, this preparation that we talked about, and also helping to kind of guide the conversation a little bit. So when you provide that information ahead of time, the doctor has a clear idea of what he's getting into. And then our loved ones often were coming from a different generation where they had very personal connections with their doctors and got to spend more time with them, which was great. But unfortunately, talking about the grandkids and, the trip they took to Aruba and all of these things is taking a valuable time that the doctor can be spending talking about, the medical issues at hand. We want them to have that personal connection. So I'm not suggesting in any way, shape, or form we take that away. However, we can help guide that a little bit for the doctor where we get those medical issues addressed. And then, letting the doctor drive how much of that conversation that he wants to have on the personal level.
I love that personal connection. However, for me, when I go in, that will derail my brain. Oh. And I'll be like, what am I in here for? So it's good to come prepared.
Mm-hmm. Exactly.
Yeah. How can caregivers best advocate without overshadowing the voice of the loved one?
Yeah. So that's such an important one. We are big advocates of always listening to our clients' voices. So even for somebody who has fairly advanced dementia, they're still likely going to have opinions about their care, right? And their wants and needs. And so we always try to provide a safe place for them to express this. Even if they're not decisional and they can't make their own decisions when it comes to their healthcare, their finances, that type of thing, they still have a voice, right? So we always want to listen to that. I really like it when I go into a doctor's office, and even though I'm there as an advocate and as a nurse, I really like it when the doctor turns to the patient and talks with them. And I can fill in the holes. First of all, preparation. I've given them the list of things we want to talk about, right? So I don't have to give that whole history again. Then I can I can just kind of step in when I need to. And the doctor will look at me when they need information, right? And they feel like they know when they feel like they need holes filled in or more information than what the person is giving. But just always know. And it's hard sometimes, especially when you're a family caregiver. You've been frustrated. It's like, mom's not doing this. She's not eating right. She's not taking her pills right. It's really easy to go into the appointment and say, I witnessed this. I've seen this. This is frustrating. She's not doing this. And by having that narrative, you're, you can put your loved one on the defensive. It makes the appointment less productive. They don't feel heard. And so sometimes just taking it back a little, let their voices be heard. You've told the doctor what your frustrations are and let them kind of take it from there.
Oh, that's such good advice.
Thank you.
It really is. What if a caregiver can't attend an appointment?
Yeah, and this happens, and that's okay. So the document that we have been talking about through this whole episode, you'll just fax that off ahead of time or send it through the patient portal so the doctor's prepared. You can call the office and say, look, my mom is coming in today. She's not the best historian. And so I'm a little worried about her maybe attending this appointment alone. I just can't be there. I'm sending you this list if you make sure the doctor gets it. And if I could speak with somebody about the appointment afterwards to make sure I have a clear understanding of what needs to happen next, I would really appreciate it.
Oh, yeah. Oh, that's great. Yeah. Because I know people worry about that.
Mm-hmm.
Now, I know you're a techie.
I am.
Yeah. So I want to talk a minute about, I have a couple questions about the tech.
Yeah.
Technology and how that can play a part. How can technology assist in managing the elderly loved one's healthcare?
Yeah, so I'm only going to touch on it this episode because tech is going to take up at least a whole episode, actually numerous episodes over time. There are a lot of electronic devices out there that are available for monitoring and tracking vital signs and other health markers. You'll have your patient portal for the doctor. If you're not signed up for it, it's interesting. We found that a lot of our clientele that we have come on will not sign up for the patient portal just because it seems like a lot. It's using tech in a generation that just doesn't use tech.
Yeah.
And so like, oh no, I'll just call my doctor. But as the advocate and power of attorney, see if you can get signed on with that patient portal. Doctors actually, for the most part, really do prefer to communicate through that patient portal. Then you've got kind of a running log of the conversations that you've had. It's easier to follow up on orders. It's easier for other providers to step in if your doctor's out of town, that type of thing. So use that portal whenever possible. That's going to be your most useful piece of tech when it comes to communicating.
Well, and also, you can see what you've asked and what you've missed.
Right.
That way.
Right. Yep. And you'll be able to look at the medication list. We'll talk more in depth about this, in future episodes as well. But one thing I can say when you're advocating for a doctor's visit is to make sure that you're taking an up-to-date medication list into the appointment, right? That's part of the documents you're gathering together. And you're going to check that medication list against the portal. They do not always match up. So if you have, here in the Seattle area, if we have clients in the Swedish system and they also have doctors in the University of Washington system, the systems may not communicate, right? And so a medication change made in one will not reflect in the other. So having that up-to-date medication list is really important, and make sure it's up to date in the portal. If your loved one goes to the emergency room and you're not there for some reason, they're going to look in the portal for the updated medication list if one isn't brought in with them or if somebody's not there to advocate for them. And if there's a medication that hasn't been taken out of the system that was discontinued, it can really affect the care that's being provided, right? Because they're providing it based on the information that they have.
Oh my gosh, that is such a huge point.
Yeah. Make sure that information's up to date. But yeah. And then with tech, this is going to be, our episodes on tech are going to be fun. There's some really, really good stuff out there to help make your journey a little bit easier.
Yeah, it's so true.
Yeah. So with that said, let's recap, the importance of preparation. Do I need to recap the preparation anymore? I mean, I think we've mentioned it once or twice on how important preparation is.
Well, you're just helping them prepare. Reminding them 20 times.
Yep. Yeah, exactly. Effective communication with the provider, that we want to encourage caregivers to be proactive, ensuring that your loved ones receive comprehensive and efficient health care. And then ask your physician what you can do better to support your loved one. And then how you can help make the next visit even more productive. For the most part, really appreciate it when they know that they have partners in care, that they are being listened to. A lot of the frustrations with physicians in caring for an aging population that may need a little more advocacy. And I'm not saying everybody. We have lots and lots of people who are aging who are perfectly fine. We really are focusing on those who are struggling a bit. So if it sounds like we're just kind of generalizing, we're not, but that's the population that we're focusing on, the ones that need a little bit more assistance and support. And so when someone comes to the doctor's office and is having a little bit of a hard time, the physician really does appreciate somebody being proactive and helping out.
Oh, yeah. Let's make their jobs easier.
Mm-hmm.
Right?
Exactly.
By implementing these strategies, caregivers can play a pivotal role in enhancing the quality of healthcare their elderly loved ones receive.
That's right. Absolutely. So thank you for being here today. We were really excited to bring you this episode. We want to remind you to like, share, subscribe, all that good stuff. Leave comments. Comment and let us know about future episodes you might like to see, questions you might have. Hear from you. Yeah. And last but not least, we want to thank a few very important people that helped us make this podcast happen. I'll let you thank the first one because he's kind of special to you.
Yes, my husband Wade did our intro and outro. His velvety voice adds so much to the podcast, we feel.
We do. And it's so much fun to record. I also want to thank my daughter, Devin, who designed our logo and is designing the branding for our merchandise. We're super excited about it. It's gorgeous. And then we also want to thank my dear, dear friend, Jeff Leisawitz, who created the music just for us for the podcast. We love it. Such a talented guy. And I also want to thank my awesome friend and partner, Paige.
I want to thank my awesome co-host and partner. Me first. Oh, wait, I'm not first.
We're having so much fun bringing this to you, and we're really glad you're here. We're looking forward to seeing you in the next episode. Bye.
Bye.
Thank you for joining us on this episode of Your Silver Lining. We hope today's discussion was insightful and empowering. Aging isn't just about getting older, it's about embracing the journey and making the most of every stage of life. Through it all, we've got you. If you enjoyed this episode, please like, subscribe, and share it with anyone who might benefit. Your support helps us reach more people. Have a topic you'd love us to cover? Send us a message. Let's continue the conversation. Connect with us on social media or visit our website at yoursilverliningpodcast.com. Join us next time as we keep supporting you and caring for your loved ones. Until then, stay positive, be well, and remember, we are your silver lining.